Welcome again to my channel, and this is the part 2 of the Sbas of the physiology which we have been discussing, and we reached on the FCBN number or MCQ number 14, and this is a continuation of a series of called 5000 Sbas before July 2023. So stay tuned, and this is the part 2 of the physiology Sbas, and let's continue. We have been discussing the SP number 14 with regard to the liver. We know that the adult liver, it weighs about 1 kg, and it is composed of the lobules, and each lobule this surrounds a central vein, which then drains into a hepatic vein. And the Kupffer cells, they are the phagocytic and line the sinusoids. Bilirubin is a breakdown product of the hemoglobin, and it is secreted by the liver. The synthesis of the lipoprotein occurs in the liver, but the main lipoprotein to be manufactured is VLDL, and plasma proteins are derived from the liver, and nearly all the albumin and the fibrinogen, they are synthesized in the liver. The neonatal liver, they weighs about 150 gram and is immature at birth, and physiological jaundice, they occur as a result of the neonatal liver failure to conjugate the bilirubin. High levels of unconjugated bilirubin, that means that it cannot be completely bound to albumin and may cross the blood-brain barrier, which can later cause the kernicterus. Now let's see your option. Option number A, Kupffer cells, they are phagocytic. Yes, that is true. Yes, that is true. And fibrinogen is synthesized in the liver. Yes, that is again true. Bilirubin is breakdown product of hemoglobin. Yes, that is true. And physiological jaundice of a neonate occurs as a result of failure of excretion of bilirubin. That is false, because it does not involve the secretion of the bilirubin, but the conversion of the bilirubin to unconjugated to conjugate. And here there is a failure of the conversion to conjugation of the bilirubin, and unconjugated bilirubin, it which is not bonded to the albumin, and they can cause the blood-brain barrier, which can later cause the kernicterus. Now option E, high density lipoprotein is the most abundant lipoprotein found in the liver. That is false, because the main lipoprotein to be manufactured is the very low density lipoprotein. Now let's move on next question, that is regarding the urine, and the properties of the urine, they includes the pH is 5 to 7, and plasma pH is 7.35 to 7.45. Proteins are nil in urine. Note there should be any glucose, and the sodium be 50 to 120, potassium be 20 to 70, osmolarity from 100 to 1000, and creatinine into 5 to 20. Let's see our option. Option number A, pH is relatively acidic as compared to plasma. Yes, that is true, because the plasma acidity is 7.35 to 7.45, but the urine pH is 5 to 7, and it composition changes with the diet. Yes, that can be true, and usually contains a trace of the glucose. That is false, because there is nil glucose, and creatinine levels are low than the plasma. There should be no creatinine, and in normal circumstances it is protein free. Yes, that is true, there should be no protein. Now let's move on SBs, and also the question number 16. And a 32-year-old primary Paris woman, they suffers a massive antepartum hemorrhage and undergoes an emergency cesarean section. During the cesarean section, she suffers a massive obstetric hemorrhage requiring the transfusion of the blood and clotting factors. As a result of this event, she develops the disseminated intravascular coagulation. Which of the following laboratory they would be expected in this condition? Okay, now let's first see what is the DIC. DIC, or the disseminated intravascular coagulation, it is a condition where there is a generalized and widespread pathological activation of the clotting system. There is a clotting within the microvascular which causes the consumptions of the coagulation product. Pathological changes, they include the inflammatory activation and suppression of the anticoagulation and inhibition of the fibrinolysis. The obstructions of the microvascular vessels, they can cause the disruptions of the blood flow to the major organs and potentially leads to the multi-organ failure. DIC, they usually occurs as a result of activation of the intrinsic coagulation pathway. These are usually increased levels of the soluble fibrin, and diagnosis is by the blood test, which usually reveals the thrombocytopenia, prolonged activated partial thromboplastin time, and low fibrinogen and increased fibrinogen degradation product. And treatment is by the reversal of the underlying cause. The fresh frozen plasma, they may be given as well as the platelet depending on the degree of the thrombocytopenia. Now let's see our options. Option number A is decreased activated partial thromboplastin time. Basically there is a prolongation of this. Increased factor 7 levels and increased fibrinogen, increased soluble fibrin, and thrombocytopenia is the true option. Let's move on next question. A 23-year-old woman, they develops the fever, and she develops the fever and has offensive vaginal discharge and abdominal pain. You are concerned You are concerned that she is the septic and wish to administer intravenous antibiotics. Prior to administration, you wish to calculate her estimated glomerular filtration rate in order to dose her antibiotic therapy appropriately. Which of the following factors includes calculating GFR? That is the option number A, creatinine. So option number A is true. And estimated glomerular filtration rate is used as a marker of the renal functions and used in the clinical practice. For example, for calculation of the renal functions in the use of the nephrotoxic drugs, it is often calculated using the modifications of the diet in the renal diet and the equations, and which takes into account the age, creatinine levels, the gender, and the ethnic group. Weight, height, comorbidities, and medications are not used in this formula. It must be remembered that the estimated glomerular filtration rate is still an estimate and may be inaccurate in the certain circumstances. For example, the malnourished protein and the amputees, and it should not be used in the children or the pregnant women. For Afro-Caribbean patient, the eGFR, they may be 21% higher than estimated. A normal GFR is more than 90 milliliter per minute. Now let's move our question number 18. And a 25-year-old primary Paris woman attends the antenatal clinic for a routine checkup at 28 weeks of the gestation, and her urine dipstick shows the glucose 2 plus. On questioning, she has just eaten a donut. Which of the following describe the sequential handling of the glucose by the kidney? Okay, first it is filtered, then reabsorbed, and then not secreted. This option B. Option B is the correct. In the normal functioning of the kidneys, the glucose is filtered, reabsorbed, and by the secondary active transport, and in on the whole not secreted in the urine. Virtually all the glucose is reabsorbed in the apical region of the proximal convoluted tubules of the kidney via the sodium glucose transporters and also by the glucose transporters. And when the level of the plasma glucose exceeds the filtering capacity of the kidney, then the amount of the glucose excreted in the urine increases. The renal threshold for the glucose, that is the amount of the plasma glucose that the kidneys are able to filter without being excreted in the large amount in the urine, is about around 200 milligram per day. Glucose-urea, they may be suggestive of diabetes mellitus and requires a further investigation. Now let's move to our question number 19. A 37-year-old woman, they attends her general practitioner uh, for the contraceptive advice, and she's a smoker of the 10 cigarettes a day and has had two children. She's keen to try the progesterone on the pill and asks you how it works. What is the most important answer? It is that the progesterone they thickens the cervical mucus, and it takes if taken appropriately, the progesterone only pill is approximately 99% effective, and its main mechanism of the action is by thickening the cervical secretion, and it also thins the endometrium and makes the embryo less likely to implant. The progesterone only pill is only effective if taken at the same time every day or within the 3 hours window. And this is due to the mechanism of actions of the pop which lose efficacy if there is a delaying in taking it. The combined oral contraceptive pills they works by the inhibiting the ovulation, and the intrauterine contraceptive device they provides a hostile environment and prevents the implantation. It may also use an inflammatory reaction, and the copper coil they also prevent the sperm from entering the uterus. Now let's continue with our question number 21. A 27-year-old woman they attends antenatal clinic at 32 weeks gestation, compl- complaining of the gradual increase the shortness of the breath through the pregnancy. Although you feel it is important to exclude the serious pathology, you are aware that this could be the normal symptoms of the advancing pregnancy. Which of the following contributes to the lung volume and capacity occurs in the normal pregnancy? In the normal pregnancy, the chest compliances the compliance increases. No, it remains the normal. It remains the same, unchanged, and then the expiratory reserve volume they increases. No, the residual volume they decreases. Yes, the residual volume they decreases. Here, this is the table for of the tidal volume, and tidal volume it is increases up to the 40%, and the total lung capacity, residual volume, and expiratory reserve volume, approximately 200 ml, and inspiratory reserve volumes and chest compliance and airways they usually decreases in the pregnancy, advanced pregnancy, and vital capacity, and sometimes respiratory rate increase and sometimes there is no change, and lung compliance does not change, and FEV1 peak expiratory flow rate that does not change during the pregnancy. So the answer will be the residual volume it decreases. Now let's move to next question. A 32-year-old woman is readmitted to the postnatal ward 10 days after an emergency cesarean section with a swollen painful calf. Her observations are stable and her body mass index is 37. You want to rule out the deep venous thrombosis. Which of the following factors they are increased in the normal pregnancy? The factor which increases in the normal pregnancy, these are the factor 7, 8, and 10. So option C will be the correct answer. And let's see a little explanation. In order to prepare the body to achieve the rapid hemostasis after the delivery, the pregnancy is essentially a hypercoagulant stage. As a consequence, there is an increase in the majority of the clotting factors during the pregnancy, and in particular the factor 7, 8, 9, 10, and 11 and 13 they do not change significantly during pregnancy. The fibrinogen and erythrocyte sedimentation ratio they may be doubled by the term, and this is an increase in the angiothrombin 3 and fibrinogen degradation products. The inhibition of the fibrinolysis is partially mediated through the placental plus minogen activator inhibitor, and the PI2. PI2 is a coagulation factor that is produced by the placenta and is only detectable in the blood during the pregnancy. It activates the tissue plasminogen activator and urokinase and is found in the monocyte and the macrophages. The procoagulant state of the pregnancy is one of the process in the place to prevent the excess bleeding after the delivery. Other mechanism includes the uterine contractions and the development of the fibrin mesh which covers the placental site. So the Option C is the correct option. Now, next, let's move toward the next question. That is with regard to the cardiac cycle. Um, which is the definition of the stroke volume? We know that stroke volume is the end diastolic volume minus end systolic volume, and so option B is correct. Let's see some important points. The cardiac cycle is the repeated actions of the contractions and relaxation that lead to the pumping of the blood from the heart and maintenance of the circulation. Myocardial cells, they contract during the electrical excitation and relax during the repolarization. During the systole, the heart chambers, they relax and fill with the blood. During systole, there is the contractions of the ventricles and injections of the blood into the circulation. The atria, they contracts together with the contractions of the ventricles occur zero point 0.1 to zero point 0.2 seconds later. And concerning the left side of the heart, at the beginning of the ventricular systole, the mitral valve it opens and pressure in the left atrium is greater than that in the ventricle. We're going to discuss this in our later MCQs as well, so don't worry if you don't understand this topic, because this topic is a little tricky. Now let's move to next question. And it is a 2-year-old unit is admitted to the hospital with the failure to the thrive and tachypnea and the difficulty feeding. He is thought to have a circulatory defect. Administration of the prostaglandin antagonist soon after the birth, they can be used to therapeutically close which patent structures of the fetal origin. That is the ductus arteriosus is the true answer, or the answer. The ductus arteriosus is one of the three circulatory shunts that exist in the fetal circulation, and it is the fetal connection between the pulmonary arteries and the aorta, allowing the oxygenated fetal blood to be carried from the right ventricle and around the body, largely bypassing the lungs. It remains open throughout the fetal period due to the high levels of the vasodilating prostaglandins, and also due to the low oxygen tension associated with the non-functioning pulmonary circulatory system. The ductus arteriosus, they usually closes permanently in the first few days of the life as the prostaglandin levels they falls, and as oxygen tension dramatically rises after the first breath, leading to the rise in the systemic circulatory pressure and falls in the pressure of the previously high resistant pulmonary circulation. A patent ductus arteriosus is associated with the prematurity and with the other causes including the maternal rubella infections during the pregnancy. Children with the PDA, they may be asymptomatic. However, a young babies, they may present with a few weeks of the life with the tachypnea and failure to thrive and difficulty with the feeding. Prostaglandins antagonists such as non-steroidal anti-inflammatory drugs, they may be used to therapeutically close the PDA. Usage of NSAIDs, they can cause the constrictions of the fetal ductus arteriosus, and hence all the NSAIDs they should be avoided in the third trimester of the pregnancy. Next question is, a 67-year-old woman is admitted to the hospital with the frequency of the urination and the extreme thirst. Her blood test reveals the deranged urea and electrolyte. Provisional diagnosis is diabetes insipidus, which hormone say acts in the nephron to increase the permeability of the collecting duct. That is the vasopressin. The option is correct. It is the vasopressin. And nephrons, they are the functional units of the kidney and are responsible for the filtration of the blood and excretions of the waste products, and the regulations of the water balance. The collecting duct is the terminal part of the nephron and receives the filtrates that has already passed through the glomerulus, the loop of the Henle, and the proximal and the distal convoluted tubes. By the time the filtrate they reaches the collecting system, it has already undergone a process of the reabsorption of the substances such as the sodium chloride, water, bicarbonate, potassium, and calcium. At the collecting duct, vasopressin, they are also known as antidiuretic hormone, increase permeability to the water, allowing for the water molecule to be reabsorbed. Vasopressin then enables the production of the concentrated urine by the acting on the aquaporins. So this is a diagram. We'll discuss it in the further lectures. And let's move question number 26. A 22-year-old 22-year-old woman is the breastfeeding an hour after the delivery. During the lactation, the letdown reflex is stimulated by which hormone? That is the clear answer. That is the oxytocin. We all know that. The letdown reflex, it is also known as the milk ejection reflex. It describes the release of the breast milk following the stimulation of the suckling, and the reflex is controlled by the actions of the hormone oxytocin, which is released from the hypothalamus in response to the suckling and cause the contraction of the myoepithelial cells of the milk duct, subsequently lead to the milk ejection. And conditioning of this reflex they naturally occurs at the extent that the milk ejection they may occur in the lactating mothers or in response to the stimuli such as the sounds of the crying baby, and actual production of the milk is largely under the control of the prolactin, which is released from the anterior pituitary gland and is increasing amount from the early pregnancy. A 27-year-old woman is being treated for the primary infertility. A pelvic ultrasound shows the multiple small ovarian follicle present in the both ovaries. She is having ultrasound tracking of her ovaries and she has irregular cycle. What is the appropriate site of the dominant ovarian follicle at the time of the ovulation? That is around the 20 millimeter or 2.0 centimeter. The dominant ovarian follicle grows considerably throughout the follicular genus, and by the time of the ovulation has reached approximately 20 mm in size. It reaches the surface of the ovary and it is released due to the necrobiosis of the overlying tissue, and the rise is the basal temperature is thought to be due to the thermogenic effect of the progesterone on the brain, and actual process of the follicular rupture that takes a few minutes, and the Mitchell Scream syndrome is the mid-cycle lower abdominal pain, and is it experienced by almost 1 in 4 women. This is thought to be the cause by the release of the follicular fluid leading to the peritoneal irritation. A 33-year-old woman they attends the antenatal clinic at 33 weeks gestation, complaining of the shortness of breath. Which of the following causes a shift of the oxygen dissociation graph to the left? And here it is the decrease to 3 this phosphoglycerate. The oxygen dissociation curve is a graph which demonstrates the percentage of the saturation of the hemoglobins at the different partial pressures of the oxygen. At higher pressures of the oxygen, the hemoglobin binds with oxygen to form the oxyhemoglobin. Each molecule of the hemoglobin they can bind with the 4 molecules of the oxygen. The sigmoid shape of the curve is thought to be the result of the cooperation between the oxygen binding sites, such as the occupying of the one of the binding sites makes it easier for the second to bind, and the same with the third and the fourth. A right shift is the oxygen dissociation curve. It indicates a reduced oxygen affinity. R for right and R for reduced oxygen affinity. This occurs when there is a increase in the temperature, acidity, 2,3 this phosphoglycerate and carbon dioxide, and hence here it is decreased to 3 pg to 3 this phosphoglycerate. Now the next question, which of the following substance is unable to bind the fetal hemoglobin? And the answer is again the 2,3 dis phosphoglycerate. They are unable to bind the fetal hemoglobin because the oxygen dissociation curve for the fetal hemoglobin is a sigmoid shape. HbF for the fetal hemoglobin they consist of the 2 alpha and the 2 gamma chains, and HbF has a higher affinity of the oxygen, and there is therefore a left shift in the fetal oxygen dissociation curve. The reason for this is the shift is due to the reduced binding of the 2,3-phosphoglyceric acid. 2,3-phosphoglyceric acid has a higher affinity for the beta chains in the adult hemoglobin, and this difference in the binding capacity between the HbA and HbF ensures that the HbF has a greater affinity for the oxygen than the HbA. The P50 is defined as the partial pressure of the oxygen at which the oxygen carrying protein is 50% saturated, and this allows HbF due to the reduced sensitivity of the 2,3-DPG, the dysphosphoglycerate. Now the next question, and also the last question of this today's session. The question is, a 72-year-old woman is undergoing the lung function test prior to the abdominal surgery. Which of the following they gives the correct lung volume equation? So here they have asked regarding the lung volume equation or the vital capacity. There are different equations given, and here the vital capacity is equal to inspiratory capacity plus expiratory reserve volume. Yes, the vital capacity describes the maximum volume of air that a person can exhale after the maximum inspiration. It is therefore the combination of the inspiratory capacity and also the expiratory reserve volume. The inspiratory capacity is a combination of the inspiratory uh, um, reserve volume plus the tidal volume and approximately 2.4 liters in a female adult. The expiratory reserve volume is determined by the functional residual volume minus the functional residual volume, and vital capacity they may be measured by the spirometry and forms one element of a basic lung function test. So here this concludes our today's session, and hope you like the video. If you like the video, kindly share it, like it, and subscribe my channel, and take care till the next videos. Stay tuned. We have started a goal 5000, and we are going to cover the 5000 mcqs or sbas and the true false before our exam of the mrcg part 1, July 2023. So take care. Bye bye.